Okay po, Ma'am Mildred.
Magandang araw po muli sa ating lahat na tagapanood, tagapakinig. Magandang araw mga classmate at sa inyo po, Doktor. So tuloy po natin ang ating pag-aaral. Ngayon po tayo ay sa lack of control. Yung function po. Lack of control. So tingnan po natin yung example 1, lack of control ng yin at saka yang. So yin is not controlling yang. So pag ang example pong sakit nito ay itong paroxysmal tachycardia. Paroxysmal tachycardia. Or pag sa ano naman po, ang tawag dito ay heart yin deficiency sa TCM, yung paroxysmal tachycardia. So pag chronic yin deficiency, ganyan po yung makikita natin nasa normal level yung yang, pero yung yin niya ay nasa below level po. Minsan pag ganyan parang wala lang muna silang nararamdaman. Tapos causes recurrent hyperactivity or hypersensitivity of yang. Yan, bigla na lang minsan tumataas yung yang, yung init sa puso. May mararamdaman siyang kakaiba diyan, mamaya po natin makikita. Tapos yang result to its normal states after some time. Minsan naman bigla rin siyang babalik sa normal. So, okay. So, heart yin deficiency during the chronic stage. Pag ganyan daw po, walang major symptoms. Parang wala lang nararamdaman. Pero pag biglang tumaas na yung yang, yun nga sa case ng tachycardia, heart yin deficiency and yang excess during tachycardia. So, nakakaramdam na po sila nung nagpapas po yung kanilang heartbeat kasi tumataas yung init. Yun, yung tachycardia kasi abnormal heart rhythm po yun regular pero mabilis ang heartbeat tapos biglang humihinto. So pag tumaas yung yang, mababa yung yin, nararamdaman po nila yun. So ang treatment po natin ito pag heart yin deficiency during the chronic state, so kailangan mong tonify ang heart yin. So hanap po tayo ng mga points na magtotonify sa heart yin. Tapos gamitin din po natin ang REN14, move front point po ito. At heart 5 bilang loop connecting point. So pwede po rin po tayo magdagdag ng common point, ang do20 at pericardium 6. So pag tumaas naman na po yung yang, ito pa pwede natin gamitin, tonify yin and sedate yang. So pag na-tonify mo yung yin, tataas at pababain mo yung yang. So gamitin mo po ang heart 5 bilang loop connecting point at REN14. Tapos sedate din po ang small intestine 4 bilang U1 source point. At pwede pa tayong magdagdag ng common point, do20 at pericardium 6. So yun po yung mga pwedeng gawin natin sa may mga paroxysmal tachycardia or heart yin deficiency. Okay po. So lack of control, example number 2. Si yin is not controlling yang. Hindi naman makontrol ni yin. One-sided recurrent migraine headache. Liver and gallbladder yin deficiency. Karaniwan po itong nararamdaman. So symptoms, madali pong magkaroon ng nervous or tense. Quick to get angry. Nagda-dry yung eyes tsaka nails. Kasi nga nagda-dry eyes kasi yun, di ba yung yin blood yun eh. So pag kulang ka ng blood, ng yin, talagang karaniwan dry eyes nararamdaman. Naapektan pati yung mga nails. Yan. So, ang treatment po dyan, tonify liver and gallbladder yin. Kasi nga mababa si yin. So, pwede po tayong gumamit ng liver 5 bilang loop connecting point po ito at gallbladder 24. Move front point. Yan. Kasi partner organ ni liver si gallbladder. Kaya pag nagtulungan sila, mas makorek po yung imbalance ng yin at saka yang. So ito naman po, strong headache, photophobia ang nararamdaman, yung ayaw mo ng liwanag, tapos sinasabayan po yan ng nagsusuka talaga, vomiting. Ayaw mo rin ng mga sound. Kaya pag sinusumpong ng head migraine, ay minsan sisigaw, huwag kayo maingay. Tapos yun, nagtatakip ng mata kasi ayaw nga niya ng liwanag. Sound irritability din. So ang gagawin po natin, treatment pag ganyan ang migraine headache niya, tonify yin. So, ulit po, palakasin, pataasin natin mabalance yung yin and sedate yang. Pababain natin yung yang. So, ulit po, ang pwede natin gamitin ay yung liver 5 uli. Low connecting point, tapos sedate, bawasan natin. Gumamit po tayo ng gallbladder 40 as U1 source. Source point, saka gallbladder 24 as move front point. So, yun. Mababawasan po yung, at actually, pag na-balance po, nawawala yung kirot ng ulo. Kasi ako po nasubukan ko to eh. Na pag ginamit mo at na-balance, nawawala po yung sakit. Tsaka syempre, iwasan natin yung source nung sakit. Kasi baka nagpainit ka or masyado kang na-stress yun. Nagmamigraine po yan. Okay po?
So, importante talaga yung diagnosis, di ba?
Opo. Kasi kahit na-sedate mo, pero kung hindi nga niya yung mga sources nung sakit, eh, hindi mo maiwasan, pabalik-balik siya.
Yes. So, iniklian natin to para medyo ma-internalize ng lahat, no? Kasi pag tinambakan natin ng maraming cases, baka...
hindi matandaan.
Oo. So, the topic today was all about lack of control. Yung una, yin is not controlling yang. Yung isa naman, yang is not controlling yin. And we have two situations, no? For each. Okay, any questions po?
Wala pa si Ma'am Ana. Siya maraming sinishare. Si Sir Lauren, baka po may gustong idagdag. O si Ma'am Elena. Hello, Ma'am. Palagay ko busy pa sila, Dok.
Yeah, busy
Naka-on
rin.
lang yung kanilang mga at nakikinig sila.
Sige,
Kasi
sige.
5 po uwian pa lang.
Nasa biyahe pa ako, madam.
Opo. Nasa biyahe pa si Ma'am.
Yeah, thank you very much, Ma'am Mildred.
Okay po, thank you din.
Okay, so next topic natin is tongue diagnosis. Andun pa po tayo sa completely cracked tongue. So part 2 na po tayo. And we're going to show you examples. So yung first case natin is 35-year-old female. Okay, una-una mong makikita, the tongue has cracks over the entire surface. Okay? With notches and cracks. Ang daming crack. And the color is not abnormal. It's pale red. And you will see a thin coating at the center of the tongue. Okay. So, symptoms niya, stomach pains, heartburn, okay, vomiting with excitement, feelings of fear. So, kung titingnan niyo mabuti, meron po siyang typical symptoms of yin deficiency. Okay, so obviously, when we look at the tongue, the first thing that comes to our mind would be, since there are many cracks, it would be yin deficiency. So next is, ano ba yung kulay ng tongue? No? So these are the symptoms. Wala pong Western diagnosis, so unfortunately, hindi matutulungan yung patient with medications. If we explore the background ng pasyente, ito po very, very significant. No? The patient is overworked, so emotional problems, constitutional weakness. Okay, so actually, when you look at the cracks, this could be a sign of constitutional weakness. Kaya wag palalain kung meron ka ng cracks. No? So Chinese diagnosis, constitutional weakness of the qi, blood, yin, and fluids. Tapos meron po siyang retention of damp heat in the stomach as evidenced by the coating. No, it is yellow thin coating, hindi po white thin coating. So, diba, ang normal is white thin coating, but this time it is yellow thin coating. So, we would be looking at damp heat. Okay. Any questions before we proceed to the next case? Okay, the next example is a 40-year-old female. So compared to the first case, when you look at the tongue, it's reddish, no? With cracks over the entire surface, notches and cracks at the sides, super daming cracks. Meron po siyang white thin coating at the center of the tongue. Okay, so I don't think that's very significant because it's thin. Symptoms, depressive moods, inner restlessness, cough with scanty mucus, hoarseness. Kasi if you look at the lung area, behind the tip of the tongue, you will see some cracks, joint pains. Okay, Western diagnosis, chronic inflammation of vocal cords. Background, overuse of the voice, irregular eating habits, emotional problems, constitutional weakness. So all of this will actually affect the patient kasi una-una meron na po siyang constitutional weakness. Kaya yung may crack na dati, kailangan ingat-ingat po sa stress, no? Or yung lifestyle. So as you can see, grabe, baka singer po ito, no? Or teacher, overuse of the voice, irregular eating habits, emotional problems. So constitutional weakness, this is something that you cannot change. So if you're going to look at it, it's a normal tongue, except that meron siyang constitutional weakness. So of qi, blood, and yin and fluids. Next, we go to case number 3. Male naman din po ito. So kung titingnan yung mabuti, red po yung tongue, and the tip is reddish. May deep vertical crack in the center of the tongue. Then you will see some notches and cracks at the sides, and no coating. So no coating, that's very yin deficiency. Symptoms, you have impotence, difficulty urinating, dribbling urine, depressive moods, irritability, heartburn. So these are typical signs of yin deficiency. Western diagnosis, hypertrophy of the prostate. So background to disease. So pwede ba nating sabihin na if you have too many emotional problems, prone ka rin magkaroon ng prostate hypertrophy. Because in Chinese medicine, the prostate is connected to the bladder, the water element, no? Okay, so Chinese diagnosis, kidney insufficiency. Why? Because the tongue is red. Remember, pag kidney insufficiency, you would always see a red tongue already. And hindi lang po ang kidney affected. So if the kidney is affected, it also affects the heart. That's why you have heat in the heart, as shown by the reddish tip. No? Pag nakita natin reddish tip, may heat in the heart. So you might want to look at the kidney. No? Okay, so kung nakikita nyo, grabe yung crack niya. So stomach in deficiency and deficiency of fluids, deficiency of fluids and stomach. Yeah. So maraming salamat po. Are there any questions? Medyo...
Dok, may ano po ako. Pag ganun po yung tongue, very masakit po yan. Pag nakakain po ng maanghang, halos talaga po masakit kasi parang sugat na rin siya eh. Tapos po pag nagka-crack na po yung tongue, pag may stress, may ganun po akong pasyente, nagkaroon ng stress pero lang yung deficient po to, nung nagka-stress, negative naman po siya sa sputum, biglang nagkaroon ng nag-blood, po siya, nagkaroon ng dura ng dugo. Nung nagpaano naman, negative. So, ibig sabihin talaga yung heat, hindi lalabas ng katawan. Kaya pag may crack, talaga po yung sinabi niyo, careful sa stress.
Yes. We should learn how to deal with stress. Don't let stress affect us. Learn to live with stress. Okay? Maraming salamat po. Any other comments? Any sharing? Okay, kung wala pong mag-share, we will proceed to the next. And let's welcome back after a long hiatus. Medyo Madam, good afternoon po. It's so nice to see you again. Si Ma'am Vina is from Baguio, buti nagkaroon kayo ng time to really come.
Opo, Doc. Thank
So,
you po, Doc.
thank
Sige
you.
po.
Ears na po tayo, ma'am.
Opo, Doc. Sige po. So, magandang hapon po, Doctor. Magandang hapon po sa lahat. So, ears po tayo, day 1. At ang ating topic natin ay tinnitus. Pag sinabi nating tinnitus po, it is a term for hearing sounds that come from inside rather than from outside. So, ito po yung ringing in the ears. So, yung ears po ay the orifices of the kidneys, and for this reason, tinnitus and deafness, ito yung pagkabingi, are often due to a kidney deficiency. However, yung ears po are influenced by many other organs, including po yung liver, heart, lungs, and gallbladder. At idagdag po natin, although the spleen is not directly related to the ears, dampness or phlegm deriving from spleen chi deficiency also may affect po yung ating ears. So, bakit po tayo nagtatanong? Ang sabi po ng author, I generally asked about any ear symptoms under 3 main circumstances. When there is a kidney deficiency, o kaya liver yang rising or phlegm. In the latter case, phlegm obstruct the orifices, and ito rin po yung sanhi ng tinnitus or yung pagkabingi. At pag nagtatanong naman tayo, sabi po ng author din ay tinatanong daw po niya any ear symptoms towards the end of the consultation. Primarily to confirm po a pattern of kidney deficiency, liver yang rising, o kaya phlegm. At paano din po tayo magtanong? When asking about tinnitus, it is important to express this symptom in terms patients, yung naintindihan po nila. So, ang tinatanong po niya whether the experience, meron bang any ringing in the ears. Importante po na malaman ng patient at maintindihan niya that even an occasional ringing in the ears has clinical significance. And in general terms, yung ating tinga may be affected by deficiency pathology, usually sa kidneys, but also of the lung and heart. Ito po yung sanhi ng tinnitus o tinnitus. Hardness of hearing or deafness, or by a fullness pathology that is usually due to yung init po, kaya phlegm. The main deficiency patterns affecting the ear are, ito yung kidney deficiency, o yin or yang, causing tinnitus and or deafness. Lung chi deficiency, sanhi rin po ito ng tinnitus. Heart blood deficiency, ito rin ang isa. The main fall patterns affecting the ears are, ito, liver yang rising, causing tinnitus and deafness. Liver fire, causing tinnitus and deafness then. Phlegm in the head, causing tinnitus, and damp heat in the gallbladder, causing yung sumasakit po naman yung tenga. So, tinnitus is caused by either failure of chi to rise to the ears, so empty type po ito, or an excess of chi in the ears, full type. In order to differentiate between the empty types and the full types, kailangan po na i-consider natin yung onset, pitch, duration, and reaction to pressure of the tinnitus. Pag biglaan po, it suggests a full condition which may maaring po internal, such as liver fire o kaya liver wind, o kaya external, such as heat in the liver yang. A gradual onset suggests an empty condition which may be due to deficiency of the kidneys po, lung, o kaya heart. Pag malakas naman, yung high pitch, may ringing noise like a whistle indicates liver yang rising. Liver fire or liver wind, whereas pag low pitch, noise like rushing water indicates kidney deficiency. So, tandaan po natin yan. Tinnitus of short duration is usually due to an external invasion of wind heat na nag-a-affect po sa Liserian channels. Whereas chronic tinnitus naman of long duration, it is due to either a kidney deficiency or a liver pathology. Ito yung liver yang rising, liver fire, at saka liver wind. Pag yung tinnitus is aggravated by pressing one's hands on the ears, it suggests a full condition. If it is elevated, it suggests an empty condition po. So, tandaan po natin, ito yung tinnitus with sudden onset and alteration of chills and fever, lesser yang pattern. Tinnitus with sudden onset and sakit ang ulo, liver fire or liver yang rising po yon. Pag high pitch, tinnitus, liver fire or liver yang rising. Pag low naman, kidney deficiency. Pag chronic at matindi na po yung tinnitus, liver fire, liver yang rising, or liver wind. Pag chronic naman, mild intermittent tinnitus, kidney deficiency. Pag chronic mild intermittent tinnitus with palpitations, and mahina po yung boses po, deficiency of heart and lung chi po yun. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much po, Ma'am Vina.
Ma'am Vina, kaya pala napakahalaga din tinatanong natin yung sound na naririnig nila sa tenga, ano? Kasi pag high pitch is liver. Pag low pitch, kasi yung parang liver yon, pag kidney.
Oo.
So, madaling tandaan.
Saka yung nagpe-press ka sa tenga.
Opo.
Asa may yun. So, yun. Maraming salamat, Ma'am Vina. We will now proceed to Paul's diagnosis. Let's ask Ma'am Mildred once again. Good afternoon po ulit.
Yes po. Paul's diagnosis. Hasty pulse. Hasty. Pulse description. The hasty pulse quality refers to the rhythm of the pulse. It denotes a pulse that is rapid and stop at irregular intervals. Ay parang ito po yung pulse nung kaninang dinidiscuss natin na na heart yin deficiency. Ano po, Doc?
Yes, oo.
Rapid din nag-stop. Kaya yung pulse niya, hasty. Okay. Clinical significance. The hasty pulse indicates internal heat and it is always related to heart disharmony. O siya yun. Although, of course, the rate and rhythm of the pulse are the same in all positions. So the hasty pulse may also indicate retention of food or phlegm, occurring against the background of internal heat or stagnation of chi or blood. Ang hasty pulse without strength indicates severe depletion of the original chi. So depletion na po yun pag wala ng strength. Then, and separation of yin and yang. This always indicates a serious condition, more so than the native pulse without strength. So mas delikado pala to kasi ito nga yung situation na biglang mabilis tapos nawawala yung pulso. Yung hasty pulse. So hasty pulse may also indicate rebellious chi from the anger. Yung pag nagagalit ka, ito yung magiging pulse mo. Hasty. Common conditions that present with a hasty pulse are mental illness, chronic bronchitis with phlegm heat, and heart disease. So, heat ang pinapakita ng hasty pulse. Hasty pulse summary of clinical significance. Heat, severe depletion of original chi without strength, retention of food with heat, phlegm with heat, severe stagnation of chi and blood. So, yun po yung mga sign niya. Okay. Combination. Hasty overflowing indicates heat in the stomach. Hasty slippery indicates long-standing retention of phlegm heat. Kasi basta tandaan natin yung slippery, phlegm, heart fire. Hasty slippery wiry indicates heart fire, liver fire, and phlegm heat. So combination na siya. Hasty floating indicates heat in the bright yang. Hasty fine without strength indicates collapse of the heart chi. Differentiation of similar pulses. Intermittent, the intermittent pulse stop at regular intervals and may be rapid, slow, or of normal rate. Whereas the hasty pulse is always rapid and stops at irregular intervals. So yung pagkakaiba po nila, irregular intervals ang hasty pulse. So rapid. The rapid pulse and the hasty pulse are both rapid. But whereas the rapid pulse is regular, the hasty pulse is stopped at irregular intervals. So pag rapid ay regular, pag hasty ay irregular. Clinical significance in each position. This is not applicable because an abnormality in the speed or rate of the pulse will be the same in all positions. So, thank you po. Yun ang ating mga pulses.
Thank you very much, Ma'am Mildred. Are there any questions? Okay, tuloy-tuloy po tayo sa differential diagnosis. And let's welcome Ma'am Nitz, you. Good afternoon po, Ma'am Nitz.
Good afternoon, Doc Hector, and good afternoon, everyone. Medyo may aso lang, okay lang.
Okay lang po. No
Okay,
problem.
thank you, Doc. Okay. Medyo maingay ang aso namin. Today, ang topic natin sa TCM Foundations number 170 is kidney failing to receive Qi. Okay? So, ang pattern na to ay resulted, wait pala. This pattern results from a dysfunction of the kidney's capacity to receive and hold Qi down. Okay. Kidney's role in the cycle of Qi is to receive clean air from the lungs and holding it down so it combines with green Qi or nutritive Qi from the spleen to form gathering Qi. Okay. When the kidneys cannot receive and hold the Qi down, it stays in the lungs, resulting in symptoms such as difficulty in breathing, especially on exertion, as well as spontaneous sweating. So, hirap siyang huminga, lalo na kapag gumagalaw yung nag-exert ba, exertion. Okay. Kidneys control inhalation from the lungs. So, when there is asthma, it is characterized by because the lungs control the exhalation. Okay, remember po yan. It is an excess type of pattern in the upper body and a type of kidney yang deficiency below. Okay, excess in the upper and kidney yang deficiency below. Okay, abundant and clear urination, which tend to happen during the asthma attack. When kidney yang is deficient, all the yang energies of the body are deficient, including the defensive Qi, since there is sweating and malamig yung mga paa, cold limbs, okay? Since the kidneys rule water, the deficiency means that it cannot transform body fluids, which gives rise to edema, okay? It tends to be localized in the face because of the lung involvement. This pattern only appears in long-term chronic conditions, hence the general lassitude, thin body, and mental exhaustion. Yun yung mga sumusunod na mga sakit. So, key symptoms for syndrome differentiation, it is marked by asthmatic cough, shortness of breath, more exhalation and less inhalation, aggravation of dyspnea after movement, and accompanied by asthenia of both lung and kidney Qi. So, siguro nakakita na kayo ng hinihika, di ba? Yun yun. Okay. Etiology, hereditary weakness of the lungs and kidneys, long-standing chronic illness, excessive physical exercise, especially during puberty. Excessive, yung masyadong marami ang paglilift at saka parating nakatayo. Okay? Underlying and accompanying pathology, kidney and deficiency, lung Qi deficiency. Possible presenting conditions, chronic cardiopulmonary failure. Okay? Sign and symptoms, shortness of breath on exertion, rapid, weak breathing, difficulty inhaling, chronic cough, asthma, spontaneous sweating, cold limbs after sweating, swelling of face, thin body, mental listlessness, clear urination during asthma attack, lower backache, dizziness, and tinnitus. So, if you palpate of the pulse, it is deep, weak, and tight. And yung tang makita mo ay pale. Okay? Treatment principle, promote descending and diffusing of lung qi, warm and supplement kidney qi. Acupuncture treatment, kidney 7, supplements kidney yang, stomach 36, supplements blood and lung qi, DU4, GB4, Mingmen, supplements kidney yang, kidney 25, unbinds the chest, DU12, governing vessel 12, supplements lung qi, REN 4, supplements kidney yang, kidney 3, supplements kidney qi and essence, bladder 23, yun yung backshoe of the kidney, it supplements kidney qi. REN 6, fosters original qi, fortifies the yang. REN 17, descends rebellious lung qi, and bladder 13, supplements lung qi. So, ang gagamitin nating technique ay with supplementation and moxa. Okay? So, you have to lung 7 with kidney 6 stimulate idadagdag niyo yung lung 7 with kidney 6 partner po yan. Stimulates the lung descending and the kidneys receiving functions. Okay? Thank you very much. I hope you learn.
Thank you very
Thank you po.
much, Ma'am Nitz. Are there any questions before we move on? Okay. So no questions. We will now go to the next one. Topic is acupuncture patterns and practice, paralysis and dementia. So we will also request the kindness of Ma'am Vina once again. Ma'am Vina, good evening po. Good afternoon po ulit.
Good afternoon po ulit, Doctor. At good afternoon po, classmates ulit. So, case study po tayo, paralysis and dementia. So, dito po sa case study natin, ang patient po ay si Mr. Zhang. 85 years old na siya. Ang first consultation niya po ay August 2nd, 2012. Ang kanyang main complaint ay paralysis of the extremities. 10 years na po, slow reaction for 4 years, and may fever po siya for 1 day. Ang kanyang medical history, yung patient suffered from paralysis of the left extremities 10 years ago due to cerebral infarction which resolved after treatment. About 4 years ago, yung patient po nagsimula na humina po at nag-respond with involuntary tremors of the upper limbs, especially in stillness. So nahihilo siya with paroxysmal flusteredness, chest oppression, and shortness of breath. At the time, yung patient po ay nakakatanggap ng, nagpapatreat siya for Parkinson disease, and ang kanyang symptoms ay minsan mild at sometimes severe po. Then about 1 year ago, yung patient had a relapse of the left-sided paralysis of the extremities. Yung pagsalita niya po ay hindi clear and inability to walk. Hindi na siya masyadong makalakad. A CT scan of the head indicated na subcortical arteriosclerotic encephalopathy. Ang kanyang symptoms were not significantly relieved after treatment, and then from then on, he could not get out of bed. He was unable to, hindi na po niya straighten his lower limbs with urinary and fecal incontinence. One day ago, nagsuffer siya ng fever with loose nasal discharge and expectoration of white and yung manipis po na phlegm. Ang kanyang body temperature was not taken at that time. And then the temperature gradually dropped by taking, meron siyang ginamit na cold capsule. but there were still runny nose. Yung patient po also suffered from, hindi siya masyadong nakakatulog, dry po ang kanyang stools once every few days, and urinary incontinence. Sa physical examination naman, ang kanyang temperature po ay 36.2 degrees centigrade. Ang pulso po niya ay 74 BPM. Respiration, 20 BPM. Ang blood pressure is 120/80. Trembling of the upper limbs and some lack of muscle strength sa magkabilang upper limbs with normal strength on the lower limbs. Pattern differentiation. Sa kasong ito ng dementia, it was caused by deficiency of 5 Zhang organs, especially yung liver and kidney, with essence and blood insufficiency. Na na-damage na po yung sea of marrow, manifesting in the dysfunction of mental activities. Yung deficiency po ng kanyang spleen also generated phlegm, turbidity, which clouded the clear orifices. Sa diagnosis naman po, TCM diagnosis, dementia due to wind harassing the upper body with liver blood and kidney yin deficiency. Ang Western medicine diagnosis, dementia and paralysis. So ang treatment po dito, ang treatment principle po ay i-enrich yung yin at saka i-subdue yung yang. Then extinguish wind and unblock the collaterals. Ang ginamit po na acupuncture point combination dito ay do 20 x HN1, do 24 GB13 XN3 GB20, stomach 36, stomach 40, spleen 6, kidney 3, and liver 3. Manipulations. Yung acupuncture points on the head are applied to awaken the brain and regulate spirit. At saka yung stomach 36 naman, at spleen 6 and liver 3 ay ginagamit to unblock channels and collaterals, achieving yung epekto po ng gathering spirit and resuming intelligence. Needle the acupuncture points, mention and retain the needles for 30 minutes. Yung 10 treatments po, makes 1 course and give 3 to 5 courses consecutively. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Are there any questions? Okay, so that was dementia and paralysis. Now we will proceed to signs and symptoms. Nasa throat pa rin tayo. And for today, we will discuss the patterns na mayroong phlegm in the throat. The first one is a full pattern, phlegm, heat in the lungs. So mayroon pong rattling sound in the throat, barking cough with profuse sticky yellow or green sputum, shortness of breath because of the phlegm, wheezing also because of the phlegm, feeling of oppression of the chest, puro dahil sa phlegm yan, feeling of heat, thirst, insomnia, agitation. The tongue is red and swollen with sticky yellow coating. Pulse, slippery, rapid. So acupuncture points, stomach 40, REN 12, REN 9, REN 5, bladder 22, lung 5, and lung 10. Another pattern na may phlegm in the throat is damp phlegm in the lungs, kanina phlegm heat. So ito naman, may rattling sound in the throat pa rin, with profuse, sticky, clear sputum that is easy to expectorate. Shortness of breath, wheezing, feeling of oppression of the chest, feeling of heaviness dahil sa dampness, swollen tongue, sticky coating, slippery pulse. Acupuncture points, stomach 40, REN 12, REN 9, REN 5, halos pareho. No? Bladder 22, may pagkakaiba lang. Lung 5 was used, lung 7, and REN 17. Now, another pattern with phlegm in the throat is phlegm, heat, and wind. Mayroon pong feeling of oppression of the chest. Okay, may feeling of heat, thirst with no desire to drink, headache, breathlessness, rattling sound in the throat, expectoration of yellow sputum because of the heat, dizziness, giddiness, numbness, or tingling of the limbs. Tongue is red, swollen, and stiff dahil po sa wind. Yung red, yung heat, swollen, yung phlegm, sticky yellow coating, slippery, wiry, rapid pulse. And the last pattern na may phlegm in the throat is spleen and kidney yang deficiency. So since this is a deficiency or empty pattern, meron po kukunti lang po ang phlegm, scanty phlegm in the throat. Pati yung rattling sound in the throat, medyo weak. Walang kalatoy-latoy. So expectoration of white watery phlegm, lower backache because of kidney yang deficiency, cold and weak knees, feeling cold, bright white complexion, impotence, decreased libido, tiredness, lassitude, abundant clear urination, urination at night, loose stools, this is very spleen yang deficiency, poor appetite, slight abdominal distension, desire to lie down, early morning diarrhea, so siguro ang alas 5, pale and wet tongue, deep weak pulse. So that was all for phlegm in the throat. Unless there are questions, we will now proceed to the last and medyo exciting na topic. We will request once again the kindness of Ma'am Mildred. Ma'am
Yes,
Mildred, yeah, for asthma. Thank you po.
Asthma. Ayan, kasi napakarami ng may asthma sa Pilipinas eh. So, asthma, allergic asthma and Western medicine, cases history. Tingnan po natin. Case history. A 2-year-old boy had developed a fever, wheezing and breathlessness a few days after suffering an acute upper respiratory infection. He also suffered from a cough with expectoration of yellow sputum. So yellow talagang nagsign na ng heat. From the Chinese perspective, this is a clear case of phlegm heat in the chi level following an invasion of Qin at the defensive chi, yung wei chi natin level. The fever and aversion to heat indicate the presence of interior heat at the chi level. From the Western perspective too, the fever indicates an infection. So pag sa Western infection yon, bacterial or viral. Sa atin sa TCM, heat. Yan. Surprisingly, the child was diagnosed with asthma and given cortisone inhalers. Most probably, the child had no bronchiolitis or viral infection from syncytial virus. Yon. Yung bronchiolitis po yung common lung infection din po yun sa mga bata. Pag nagsuswell po yung airway, nagpo-produce ng mucus. Kaya yon, madalas ito ay caused daw ng virus. So late onset asthma. Late onset asthma, also called intrinsic asthma, normally starts later in life, yung mga may edad na, and is due to bronchial hyperactivity. In this case, there is no familial history of asthma and no eczema. Late onset asthma occurs in atopic individuals, and although in some cases, it may be triggered by certain allergens. Halimbawa, yung lagi silang may alagang pusa, nakaamoy ng mga halaman, yon. Magsusumpong yung asthma. It does not present all the typical trait of atopic asthma. In other case, it would appear the external allergens play no part in the etiology of this disease. Yan pa yung nangyari. Pag may family history, nagkakaroon usually ng negative. Tapos magkakaroon ng attack related to the infection, exercise and other stimuli. Pag sobra silang, yun nga, yung na-expose sila sa mga mga balahibo ng pusa, o yung laway ng puba, yung halimbawa hinigaan nila, hinigaan din ng pusa. Tapos may mga bulaklak, yung sumusumpong po. Skin test usually negative. So, no history of eczema in childhood. So, unfavorable response to hypersensitization. So, yun po yung mga characteristic of non-allergic late onset asthma. Yan po yung figure. Some authors give a general guideline to differentiate intrinsic from intrinsic asthma based on the age of onset. When asthma begins before 30, the cause is allergy unless proven otherwise. When it begins after 40, the cause is not allergy unless proven otherwise. The diagnosis of asthma is done on the basis of lung function tests, forced expiratory volume, FEV, peak flow charts, peak exploratory flow rate, PEFR, exercise test, histamine provocation test, and skin test. So, ang daming test na ginagawa po, Inhalation of an allergen that produce large swell on the skin also trigger of asthma. Sputum and blood tests are done to exclude bronchitis, as a large number of eosinophils in the sputum point to bronchitis. So, in-X-ray din po, X-ray have no diagnostic value. Walang diagnostic value pag in-X-ray ang asthma, as they show no particular feature in this disease. Clinical features. Asthma is characterized by wheezing attack. Yun yung naririnig na natin na yung parang may pusa po sa dibdib. Tapos nahihirapan silang huminga. Which are usually worse at night. Sometimes there is a dry cough, which is also worse at night. The onset is sudden and preceded by tightness of chest. The dyspnea and wheezing occurs mainly on exhalation. With fixing of shoulder gurgle, yung parang halos mga tumataas na po yung kanilang balikat, the patient like to sit up. So, mas gusto na nila nakaupo kasi pag nakahiga, mas lalo silang nahirapan. It is in the very nature of asthma that occurs in paroxysm. That is it, come and goes. Indeed, some chest specialists say it is not so much the symptom themselves, yung tightness of the chest and wheezing, that enable us to diagnose asthma. The symptoms are present in other chest disease as the circumstances under which they occur. So, yun po yung clinical picture. Okay po, may sharing tayo, may dagdag.
Sino ba asthmatic dito? Mukhang wala yata ang aamin. But anyway.
Karaniwan daw pag nagkakaroon ng asthma nga, yung halos pag namagana po yung yung kanilang mga veins, lalo pa pagpapunta sa puso. Tulad po nung naging pasyente namin noon na nag-comatose. Namagana po yung veins noon sabi ng doktor magana siya. Kaya hindi na makadaan yung dugo. Tapos nag-purple na po yung kulay. Pero nung na-acupuncture, na-stimulate yung energy, ayun po, nagkamalay.
Wow. Ang galing, no?
Kaya nga po, kung walang acupuncture, tuloy-tuloy na po yun mamamatay.
Yun.
Yung mga na-re-energize po yung lungs niya at saka yung heart, lungs, yung po yung mga tinusos. Siyempre sa kamay kami naglagay kasi nandun po siya sa sa ambulance. Habang tumatakbo ang ambulance, yun, inaano po namin. Talagang energize namin. Kasi yung mga sign and symptom po nung parang heat, maraming heat po siya. So sedation din po yung ginamit.
Okay.
Nakatulong yung kalog-kalog dun sa ambulance. Nabuhay po.
So, thank you for sharing, Mang Mildred. Sino pa po gusto mag-share? Okay, if wala na pong questions, we would like to invite everyone tonight at 8 o'clock, still on the 5 Shoe Points with Dr. Gavino. Talagang andun na siya. Maraming salamat po sa lahat, especially sa mga presenters. Good evening, everyone. See you po later at 8. Good evening po.
Thank you po.
Good evening, Doc.